Stop scrolling. Knowing how to give artificial respiration can save a life in an emergency. Today, we will show you step-by-step how to perform rescue breathing safely and effectively. First, check the scene for safety. Make sure you and the victim are out of danger. Then, check if the person is responsive by tapping their shoulder and asking loudly, "Are you okay?" If there is no response, call emergency services immediately. Next, check if the person is breathing. Look for chest movement, listen for breath sounds, and feel for air on your cheek. If the person is not breathing normally, begin rescue breathing. Tilt the head back gently by lifting the chin and opening the airway. Pinch the victim's nose shut, cover their mouth with yours, and create a tight seal. Give one slow, full breath lasting about 1 second, watching the chest rise. Remove your mouth, allow the chest to fall, and give a second breath. Continue giving 2 breaths every 5 seconds for an adult or 2 breaths every 3 seconds for a child or infant while monitoring for signs of recovery. If the chest does not rise, reposition the head and try again. Remember, if the person starts breathing on their own, place them in the recovery position on their side, keeping the airway open and monitoring them until help arrives. Always stay calm and confident and follow the rhythm. Check safety, check responsiveness, call for help, open airway, give 2 breaths. Repeat as necessary. Learning rescue breathing and CPR can save lives, and practicing on a training mannequin regularly improves your technique and confidence. Share this video with friends or family so they also know how to act in an emergency. Remember, your quick action can make the difference between life and death.